Are we on, Dhruv?
One, we are live.
20 seconds, sorry.
Yes, 20 seconds. Three, two, one. Please start your session.
Good evening, everyone. My name is Rohini Manchanda. I'm a public speaker and associated with SeekMed. SeekMed is a global telemedicine platform which connects the patients from around the globe to India's award-winning doctors through a video consultation. Ever since the lockdown and this pandemic, we all have faced many struggles. And it's not just in India. The whole world is facing so many challenges. But there's one struggle which is quite not discussed much, but has a long-term consequences. That is, our bones have gone really stiff because there is not much activity we are doing. With this new normal of working from home and social distancing, everything has changed around us. Yes, the mental health is affected big time, but it's also affecting our physical health, especially our bones and mainly our back. Imagine we used to go to work, we would sit for hours and work, but then we'll get up and go for coffee with friends or take a walk around our offices just to take small breaks, which is very much required. But things are different now. So today we are here to talk about the right ways to care for your back and bones with the new normal routine. And to discuss and enlighten us with this very important topic, we have with us Dr. Prakash P. Kotwal, MBBS, MS Ortho, FAMS, FIMSA, Chairman, PSRI Hospital, New Delhi. So a very warm welcome to you, sir. And I request you to please give a brief introduction about your specialty and expertise, please.
Hello, good evening, everybody. My name is Dr. Prakash Kakawal, as said by Rohini, and I'm an orthopedic surgeon. I worked at the All India Institute of Medical Sciences, which is a premier institution of the country. I nearly worked there for nearly 40 years. I retired as professor and head of orthopedics, and now presently working as chairman of orthopedics at the PSRI Hospital in New Delhi. And my special areas of interest are the upper extremity, hand to shoulder, which includes the joint replacements, fractures. And then I also deal with the spine, fractures of all kinds, and pediatric orthopedic, that means the problems of children, and so on and so forth. Actually, since I worked at the All India Institute, which is a premier institute for nearly 40 years, that gave me a very big platform to gain experience in the variety of complex problems of bones and joints.
Right. Thank you so much, sir. So before starting our questions, I would like to inform all our viewers that this is a live webinar. And if there's anything you want to ask the doctor or have any related query, please write to us on comments and we will try to take up all the questions right away. So let's begin. So doctor, the first question I would like to ask is that backache is the most common problem, which we see generally. What are the reasons for it?
See, there are multiple reasons, and the reasons vary according to the age where the person is suffering from, particularly right from children to adults to elderly and so on. The commonest people who are affected with backache is the people of the adults and the elderly people. And in that age, the common causes are maybe slip disc. You might have heard this term. Then the fractures. Then sometimes tuberculosis or infections like TB. Sometimes tumors. And the commonest is the cause is postural, because many times the way we sit, we are lying down. We are actually lying on the sofa, watching the TV or reading a book. So those kind of postural, or sitting in the office in the office chair for hours together without caring for the proper posture. So that is also the cause for the backache. And
Right.
in children, generally, sometimes the diseases like TB, which is so common in this part of the world, that is the cause for backache. So there are multiple variety of causes.
Right, sir. But I think there are so many reasons where people don't even realize and it just happens on their own.
Yeah.
So how can we actually prevent the backache, or say what can we do to cure it?
That's a very good question, and actually very practical thing, because like all of us, some time in our life must have experienced backache of either a severe nature or a mild nature. And the first and the foremost thing, as I said, the postural cause is the commonest cause of backache. And I would say nearly all the patients who come to the hospital with backache, and the commonest cause is postural, which may be about amounting to about 60 to 70% of the causes is in patients is about the postural. And so the first and the foremost thing is that you must observe a correct posture at everything. Where you are working in the office, sitting correct. If you are working on a laptop or a computer, it should be the level of your computer screen should be at your eye level. The chair should, the back should be well supported, and so on. If you're working in the, if a lady working in the kitchen, working, you are doing your dishes in the sink. So the most of the times, you are bent up like this. So that causes strain to the back. If you are lifting something, and that is the most common, another common cause. If you are lifting some weight from the taking it out from the car boot or from the floor, and you bend like this, and then you pick it up, that's the worst way to do that. And apart from that, then the even in your bed, the mattress that you have, if it has become sloppy, or if it is not giving you enough, not giving enough support to your back, that can also cause backache. And the best thing to know whether your mattress is actually needs a replacement is that after 8 hours of sleep on that mattress in the bed, if you wake up with backache, strain in the back, that means your problem is that with your mattress, you need to change that. So these are the broadly speaking some very common ways, practical ways to prevent your backache. And the another important thing is that you must be doing exercises to your back to tone up your back muscles. That can be learned from a physiotherapist, and even these days these are also available on the YouTube, or the correct way to do that. But it is better to consult a physiotherapist or an orthopedic surgeon to know exactly.
Right.
And then that if it is done, then if the back muscles are toned up, then obviously you don't get backache. Yeah.
Right, sir. Right, sir. So, so this was about the back, and you actually told us the very obvious and actual reasons behind it. But often it happens that our bones also start to hurt, not just the back, but other bones also start to hurt. What are the reasons for that?
This is also a very practical problem. Many times the bones, people get backache, people get pains in the bones here and there at various sites, and the common age for this the patient that who they get it is in the adult age group, around let's say between 50 and 70 years of age, particularly in the ladies at that age. And the reason for that is because if the bones are weak, and that happens because if there is deficiency of calcium, vitamin D, and the other constituents in the body, so that causes say weakness of the bones, which gives rise to bone pain. And as I said, ladies, because particularly in the ladies after menopause, because of the hormonal changes, the bones become weak, they become brittle, and that so for the backache, this is also one of the important causes. That is because, and that condition is called as osteoporosis, when the bones become weak and they become brittle. So that is called as osteoporosis, and that osteoporosis can also cause pain in the back and pain in the bones. And this is also true in the childhood as well, because if the children they have from a lower socioeconomic group, if they have pains or the deformities in the legs or the hands, that is because of deficiency and a condition called as rickets. So, but in the adults and elderly, it is because of the as I said, because of deficiencies of calcium and vitamin D and osteoporosis.
Right. Right. And as we speak, actually, sir, we do have a question from one of our viewers.
Yeah.
He says, so Mr. Rahul has asked this question that my mother is 50 years old and she has been suffering from diabetes for about 13 years now, given insulin a year. Severe pain in his ankle for 10, 11 months. At first, it was on one leg. Now he's feeling the same problem on both legs. The pain is more when sitting or waking up. Pain in the soles of the feet. It seems that he's pushing with a needle. He has been, she has been hurting her knees and ankles for a few days. Soft shoes are also worn almost all the time. So what should be done?
So the reason for her pain in the feet, most probably, most likely, and the sensation, what important that you said is because of getting, as if pins and needles, pin pricks
Right.
or pins and needles sensation in the foot. And in a
Right.
person who is having long-standing diabetes for 15 years or so, generally that occurs because of the changes which happen in the nerves in a patient with long-standing diabetes. It's called as neuropathy. That is the most likely cause. And for that, she needs investigations to be seen about the status, the control of her diabetes, and the status of her nerves, whether that is causing the pain in the foot. And also at that age, if she's getting pain in the knee and the ankle, the more commonly the knee, it is because of the wear and tear of the knee. So this is another third condition which is called as osteoarthritis, basically wear and tear. What happens is that as we use our joints for all our life, and like the machine parts wear off. Similarly, the joints also start to wear. This starts happening after the age of 40, 45 years or so. And as they start to wear out, they cause pain in the joints, particularly the knee joint. So for that, the investigations are required, and it requires an X-ray or some other investigations to see, and then the diagnosis can be reached. What is the problem in her knee joint? I can't hear you.
Sorry, can you hear me now, sir? Yes, sir. I hope that we have managed to answer your question, Mr. Rahul. And we have another viewer, Ms. Seema. Ms. Seema Jain asks, can gastric problem also can lead to shoulder girdle pain?
Not really directly. Gastric problem to the shoulder pain, not exactly. This may be kind of going side by side. She may be having some. This also depends as to what is the age of the person, because even with age also, like as I said, the wear and tear also happens in the shoulder joint as well, and sometimes there is difficulty in there for the person to lift the arm, to take it behind or to take it in the front, and so on. That's because of the tendons and the muscles which lift the arm. They are swollen, and therefore some investigations in terms of X-rays and MRI are required. And of course, if there is some other problem in terms of some hormonal change or something, then that can also lead to, maybe associated. People who have diabetes also sometimes develop problem in not because of diabetes, but there is an association. They develop problem in the shoulder, and sometimes which is called as frozen shoulder.
Right, sir. She's actually also mentioned that the diagnosis is L4, L5, S1 mild disc bulge, and it's indenting anterior thoracic, and her age is 32 years, she says.
Oh, she is young, and because this is a different issue, and this back problem with the disc bulge, what you're saying, is also commonly called as slip disc. That means what has happened is that in her back, between the uh, we have the back, we have the vertebrae, blocks of vertebrae which are kept one over the other. So in
Right.
between the two vertebrae, there is a cushion, and that cushion is also called as lip. The disc, it gets displaced and puts pressure on the nerve. So this actually she needs obviously an opinion from an orthopedic surgeon as to whether
Right.
the physiotherapy can treat her, can make a cure from her problem.
Sure. So, Ms. Seema, I think as the doctor says, that physiotherapy is the better option for you, and to diagnose and then to see for that as well. I hope that answers your query. And moving on to our question, sir, is there any special diet which one can take for healthy bones?
Yes, certainly, because it's the most important thing is that the diet must be a balanced diet. You know, which should have all the constituents that we have, and in protein, carbohydrates in the correct position. I mean the portion, and also it must include green vegetables, milk products, milk protein, depending upon the age of the person and the condition. The patient should not be diabetic, because for diabetics there are certain restrictions from the food as well. And because generally what happens is that the people who miss their meals, they don't take breakfast, miss their lunch or dinner, and the diet is not a nutritional diet. They are, because of the fast life, they are more used to having fast food and that kind of a thing. So that causes deficiency in the body in calcium, vitamin D, which I said earlier, that leads to bone related problems. No, you are muted.
Right, sir. Right, sir. Right, sir. So, how about if, like, we generally hear about this thing that there's a more tendency of neck and shoulder pain in taller people as compared to the people with a shorter height. So, what precautions can be taken for them? Like, even if I talk about myself, I'm also very tall, and I also feel a lot of pain in my neck and shoulder, because, of course, when we are standing tall and everything, it kind of creates that kind of a problem. So, what precautions can be taken in
The
terms of
young
that?
persons and young working persons and like executives and all those things, they are most of the time they work for long hours, mostly on laptops or computers and that those kind of gadgets. And the reason for pain in them is because of long sitting on the computer without taking proper precautions while you're working at the computer. And this kind of job, uh, or the desk job, office desk job, can cause pain in the neck, in the shoulder, cervical, pain in the hands while you're using the mouse and all those things. And in fact, all these conditions are nowadays clubbed under one new term, which is called as CRI, computer related injury.
Right.
Right. So all these things happen because you are not taking proper precautions. They are not taking proper precautions while working for on the computer for long hours. As I told you earlier, your back must be well supported in the chair, in your computer chair. You are the monitor should be at your eye level. The when you are using the keyboard, the wrist should be straight. It should either be like this or not like that. You should take a break every 2 hours.
All right.
Okay, you get up and walk around, and I often advise my patients that, what, while you are working on the computer, what you should do is you should keep a bottle of water with you, keep drinking. So by default you will have to get up and go to the washroom every 2 hours. And
Right.
if your body is hydrated, it has its own advantages, good skin, good GI, and everything for that matter.
Right. Actually, I think so. We are on a very hot topic today because we've got so many queries from the audience. So let me take one from the audience first. Mr. Yadav, Mr. Ajay Yadav has asked, I have a hip joint, right hip joint problem, bone, since last 7 months. Its treatment is on the way in RMN Hospital, New Delhi. Doctors have told me, according to X-ray, that my hip joint round circle has got some damage due to the TB. I have big problem regarding walking. I cannot bear whole weight on my right leg. It gives me an unbearable pain at thigh, waist, front and back, side and hip. On laying on bed, I am unable to straighten and bend my leg. It gives unbearable pain. Please help me. Any kind of medicine or exercise what can be suitable for me.
As I understand, he is suffering from TB, right? The doctors have told him
Yes.
the TB of the hip joint. Yeah, of course, I cannot advise without seeing him, his investigations, X-rays, MRI, and other things. But yes, the most important thing that I will tell him, like to advise him, that if the doctors have done all the investigations and have reached to a diagnosis of tuberculosis of the hip, then he must actually do two things. Number one, follow the advice of lying down or walking or exercises, whatever the orthopedic surgeon has told him. Number one. Number two, he should keep his diet good, because his body is fighting against a major disease. So he should be taking a good nutritious diet again, so that his, like we talk about immunity these days so much. So his immunity must go up. So that's why the body will be able to fight against the TB bacteria. And the third thing is that he must continue with the medicines that has been prescribed to him. The medicines, that treatment will last for a longer time. And generally what so happens is that after some time, you get little careless and you skip the medicines, or you forget about it, or you think, well, I have taken it for enough now, I don't need to take it myself, and all those things. That actually is the worst thing to happen. This can cause the disease come back with vengeance or with more complications. So this is the advice that much as can give him on right now. But otherwise, the further advice, the specific advice about the disease and this thing can only be given after examining him as well as his investigation reports and all that.
Right, sir. That's absolutely right. And so there's another person, Mr. Anirban Das. He asks, when my wife wakes up in the morning, she gets pain in the sole of the feet, and she finds it difficult to walk without wearing slippers. However, after some time, it goes away on its own. So, what can be the reason for the same?
Generally, what happens is that this is actually the feet. The pain comes in the sole, in the heel pad. Where we put our weight when we get up from the bed, and in the heel pad there occurs swelling or inside the inflammation inside the heel pad. Sometimes there is also an extra bony outgrowth of the heel bone that can be seen on an X-ray. So that also irritates the tissue and causes pain. So obviously, I think should be doing some hot fermentation before going to bed. You take some lukewarm water, add some salt to it, and do some fermentation. But otherwise, she must consult an orthopedic surgeon. Perhaps he would get an X-ray or an MRI done, trying to find out if there is inflammation of the heel pad tissues, and then further treatment can be advised.
Right. Thank you so much, sir. I hope that we managed to answer your query, Mr. Das. So the other question we have is from Miss Mansi. She says that, sir, my mother has a swollen or inflamed knee. It's been from 3-4 months. It's been from past 3-4 months. The knee was also radiating warmth when inflamed. But with prescription from local orthopedist, while the pain had subsided, but the area above knee still looks inflamed, and she still limps while walking. She has also got X-rays done, and the doctor advised the knee does not need any replacement. What could be the possible reason for the condition? Thank you.
Well, it's difficult to say again without examining, but since if she feels and if she can make out that the knee looks inflamed or swollen or something, then again, I think she must consult an orthopedic surgeon, maybe wherever she likes, because now the X-ray has been done, as you told, and the X-ray looks all right, right? And this is what she has been told. But now the MRI perhaps is required, because you see, X-ray gives information only about the bones. It does not give information about the soft tissues. Right. So now an MRI is required to see whether there is any inflammation in the soft tissues around inside the knee, about the other muscles, nerves, capsule, and the other things which are the soft tissues. So for that, an MRI may be required. And apart from that, certain more blood investigations may be required if the knee is really inflamed, trying to find out what the cause of the knee inflammation, because there can be many causes. There can be an infection, there can be some kind of arthritis, or it may not be anything, just because of the little wear and tear of the knees. So that can also be treated by physiotherapy. But the basic thing is to reach to a proper diagnosis.
Right, that's absolutely right, sir. Thank you so much. And also, sir, what are the best foods for source of protein that could be included in the diet by vegetarian who are vegetarian?
Yeah, vegetarians can have paneer, they can have the pulses, rajma, or those kind of thing. They can also have, these days there are those preparations available, Nutri Nuggets, and they also contain protein, so they can be used in the diet. So this is they can really have, and obviously if at least.
Hello, can you hear me, Dhruv?
Hello.
Yes, sir. Yes, sir. Sorry, there was some maybe hitch from the internet. Yes, sir.
Yeah. So I said that, they can use paneer, they can use curd, and other,
Yes, sir.
yeah.
I think that's the best food which can be prescribed by the author, of course. I think it's always better to consult a dietitian as well if you are really concerned about the diet which you
Absolutely.
should take for the
Absolutely.
proteins and the nutrition for that. And so as we spoke earlier about the bone tuberculosis, does it come under ortho problem? Does it?
Yes. If
And
the the tuberculosis can affect any part in the body, right from the head up to the toes. So it can affect any part in the body. And when the tuberculosis is affecting the bones and the joints, or the spine, or the back for that matter, it comes under the this thing of orthopedics. So
orthopedic.
you can consult.
But
We are talking
as
about the dietitian just now. Sorry to interrupt you. It is also very important to consult a dietitian, because actually either what mistake people do is they either tend to maybe consume such things which has high calories and they put on weight, or they try to go on a crash diet, or trying to do that towards themselves. So that also causes that lowers the body immunity, and that's
right,
how you catch infections. Even catching an infection as TB or something also, it happens because the body's immunity at that point in time was at the lowest, and that's how the bacteria invaded your body, entered your body, and have started affecting that. Yeah, you were saying something.
that's actually a very valid point, sir, because a lot of time it happens that people think that okay, banana is healthy, so we can have like a lot of bananas or anything, but it's the same thing with the diabetic patient. I guess it can cause a lot of problems as well. So I think it should always concern the dietitian properly, for the proper diet that one should have, considering the medical history and everything. So that's a very
See, the
very valid point.
dietitian will give you, will make a diet chart for depending upon your requirement, 1600 calories a day or 1800 calories a day, which will include
Exactly.
what you should eat from morning till evening and all that, so that your diet remains within that 1600 calories diet.
Right, sir. Right. Thank you so much, sir. But so there's another viewer of us, and so Mr. Sinha, he asked whether L4, L5 slip disc can cause pain in the lower part of the abdomen, especially in the area a little lower than appendix.
Um, well, theoretically speaking, the backache actually can cause pain all around, because the nerves, they go from the back, and they radiate and come in the front, go to the thighs and all those things. So yes, theoretically speaking, it can cause. But having said that, at the same time, if the person has more problem about the pronounced pain in the lower abdomen than in the lower back, then I think you must consult a surgeon for that matter, just to rule out that there is no other problem in terms of an inflamed appendix or whatever. I mean, a surgeon will be able to tell him best. He should not actually presume that this low back pain is also causing the pain in the lower abdomen. So that must be ruled out.
Sure. It could be something else which is causing the problem. It should not be the reason then.
Absolutely, absolutely.
Right. That's great, sir. Thank you so much. And so there's another question from Mr. Rajan Das. He says that my age is 32. I have a pain in my right wrist. When I push anything with my right wrist, I feel lack of strength. And I do work out regularly as well. So what could be the reason for that?
You must consult an orthopedic surgeon, or if possible a hand specialist, hand surgeon, because if he is doing a lot of workouts and overdoing it or something, whatever, and if he feels loss in the strength in the hand, then it must be investigated, because what is the problem? He may require an X-ray, not only an X-ray, but he may require an MRI as well, because in this small area of our wrist, there are in this much area of our wrist, there are 8 small bones, and they are held together with ligaments. So if there is any problem between any of these bones, it disturbs the synchronization between those 8 bones, and this can cause problems. So you must consult a hand surgeon.
Correct, sir. Thank you so much. So I'm really glad that we are trying to help a lot of people today, because we're getting a lot of questions, and it's really nice. It's always feels great to answer as many questions as we get from the audience. So there's another one we've got from Miss Nidhi. She says that my dad feels pain in his legs and arms most frequently. Sometimes he takes painkillers also, but I think painkillers every time are not good. So suggest what we can be done.
Actually, again, without seeing, I cannot suggest, but you must consult a doctor, maybe a physician or an orthopedic surgeon, because the basic thing, as I said again, is trying to find out what is the cause of that pain. Just taking painkillers is, as you rightly said, is not good. It can have its side effects. It can have side effects on the stomach. It can have side effects on the kidney, liver, and all those things. Although I'm not trying to frighten them, but I'm trying to just warn them and caution them that instead of self-medication, they must consult a doctor and get the proper diagnosis.
Right, sir. Thank you. Actually, to tell our audience, I think, guys, let me tell you one thing. Whenever it comes to our physical and mental health, it's always great to consult a doctor, because I think in India, we have this tendency that we go to a chemist, we buy like a normal paracetamol and we keep eating this. So I think it's always best if you are seeing a repetitive pain in your body, or any kind of body part or a bone. So I think it's always best to consult a doctor, because you never know that what's kind of grooving inside your body, because there are so many things which could go on. And especially at the age, after the 40 years of age, like some people actually kind of put questions for their fathers, for their mothers. It's always great to to have that information in advance from the doctors, that what should be done, rather than making our own expectations, or our own assumptions that okay, we'll just keep doing this. Because at times we say that okay, doing exercise can create a lot of can help us, but it might create a lot of problem in your body, because what's going on, we never know. Right, sir?
No, you said very good, two good things. One
Yes,
is
sir.
about the self-medication. See, once in a while, if you are having and you pop up a pill, paracetamol or something, that's all right. But if the requirement is becoming more frequent, then you must consult a doctor. That's number one. And also, if you are doing a workout, you go to the gym, you should not overdo it. See, when you go to the gym and you see the next guy who is doing it for 1 hour or so, and you think that I must also do it that way, so that may harm you because you are overdoing it. You should do it within the limit of your tolerance of the body. And see, I often give an example. If I want to run a marathon, I cannot run 40 kilometers on day one. It has to be gradual.
Absolutely.
So this is how it should be with the workouts as well, either at home or in the gym, and never overdo it. That causes more problems.
Right. That's so true, sir. Thank you so much. And actually, there we've got other questions as well, like how to get rid of back pain, but we've already answered that questions on the second question. If you guys can just watch it at the end of the show, at the end of this webinar, you can always have a look at it. So, but there's another question which we've got from Miss Seema. She says that I do also have inguinal pain on left side. The same side I have L4, L5 disc bulge and shoulder pain on the same side. So is it because of that, or there could be other reasons for it?
It needs to be seen actually that L4-5 disc bulge putting a pressure on the nerve can cause pain, but it will cause pain on the side of the disc bulge. If the disc bulge is on the right side and the pressure is on the right side, then the pain would be on the right side. If it is happening on the left side, then there must be some other reason that needs to be found out. So an MRI also sometimes is done with an injection, without an injection. So that also gives valuable information about the reason why, what is the cause for the pain.
Right, sir. But sir, at a lot of times we see that there is no exposure of sun in India. Like people do not go out, and then there is no much exposure of sun for them, and that leads to a deficiency of vitamin D. What is the right treatment of taking vitamin D sachets after the age of 30, 40, or at any age probably?
Well, you have picked up a very good point. The thing is that we have so much of sunlight in our country. So get vitamin D is a natural which is synthesized in your own when you sit under direct sunlight. And the best time to do is to sit in the soft sun for about half an hour, arms and legs exposed. Sit for half an hour, read newspaper. That is the best way to. But if it is not possible, vitamin D sachet in high doses is The dose of that actually is either once in a week or once in a month, depending upon blood level of vitamin D. That we get done is we get an blood which shows that how much is the deficiency level of vitamin D in your body, and if it is too much, it is given once in a week. Much after some time, then the dose is once in a month, and then if the level has come normal, then there is no need to take additional vitamin D. Even if you just take a bit of calcium every day, that gives the daily dose of calcium, dose of vitamin D as well.
Right, sir. And actually, your answer brings us to a very commonly asked: how often the investment or vitamin D or B12 should be done? How often should we get the test done to make?
Yeah. See, if somebody has deficiency of vitamin D or these is put on treatment, then she is regularly taking the treatment. 6 months or so, you get the blood test done, know how much is the level. But these days, there is this thing to annual checkup done once in a year. Non-symptomatic person. It's also a good way of doing it after a certain 45 years of age. Generally, the this checkup, this call it as to get once in a year. That is good one, because if deficiency or some treatment can be followed up.
Right, right. Thank you so much. When we talk about the calcium and the vitamin, that there is always more calcium deficiency as compared to men. So,
see, the reason because of lactating mothers and afterwards, and generally this thing are not they cannot either they cannot afford a very good socioeconomic group, or for that time are not very particular about it, about having a good diet and everything. The requirement, feeding the baby and also for a calcium, these things increase. Generally, a deficiency of that is seen, and more in our setup many times. So, in 2 or 3 days, not very particular about their meals and these things. So all these things over a period of together causes these constituents in the body.
right, sir. Thank you. I think these are the tasks which are very commonly asked and people need. So we'll take more questions from the. We got one from Mr. Satish, which question is that, sir, I get pain often in back, shoulders, blade pain. Sitting for more than 10 hours, workouts which give some relief. Never used any medication. Pain after resting or after a few days. Should be done to get rid of the pain.
Yes, perhaps it's because of sitting and the posture that which may not be posture for him. So he consult an orthopedic surgeon. They require an X-ray seriously long, and if there is nothing which I suspect there should not be, then he actually requires some or back exercises to muscles, and also consult the doctor for his care of his back while he is working on what type of chair and how long sitting at a stretch and so on.
There's this one question which is this that so I used to play when I was in school. So I remember when I this. So there's this called contrast therapy, which is like using hot water bottle for cold ice water, like giving a shock therapy to work, which can soothe the pain. And how does it work out?
Specific treatment modality in physiotherapy must be taken instructions or guidance from a physiotherapist or an orthopedic surgeon. Yes, one of the treatment modalities.
Sure, sir. Thank you so much. That's a very good point. That whenever you hear something, it's always great to before doing anything to your anything which you think that might relieve. So I hope that we managed to answer viewers, and thank you so much for your time, and mainly we really appreciate your time. We know how valuable your time is. In this, I request you, sir, to please give out a small.
Young adults, the working, all these things, as I told also, that they must take care of long hours of sitting on the chair. This thing they must follow that. These days is the ergonomic advice. Back, like I'd been telling, should be the level of your computer. Should you be sitting and all that. The second thing is take care of. So these days we talk for a different reason, right? It is also important other than corona. So the fitness of your body to against any infection for that matter is take care of your diet so that is good, and the do some physical um, whatever that you even about 40 minutes a day so that muscles fit, you are in a good condition, your joint, and that is how you work 18 hours a day or without having backache and muscle.
Sure. So that's a great message, sir. Thank you so much. And we on our webinars, we try to. We are almost on the end of our webinar. But question from one of our with you, sir. Can we take that one?
Sorry, sir. Yeah, sure. The last one.
Sir, the last question we're going to take. So, that sir, I recently and calcium test done. Vitamin D was 2 and calcium was 9. We just talked about sitting in the sun, exposing, having vitamin sachets. To have sun exposure, I'm really sorry while you were telling. So how long would it bring the vitamin D to the required level? Is it a cause for a worry for the future or not?
No, not exactly a cause for worry. Not so bad as well. Nevertheless, the question about the exposure to the best time is in the soft sun. That's when you can. So in the soft sun, about half an hour, 20 minutes or half an hour is good enough, because after that, anyway, you becomes gets
Sure, sir.
hot.
Sure.
Yeah. So this is the
right. So the topic is really new one, and we're still getting so many. If we have forgotten to answer your question out on this one, we will definitely try to reach. Just we would write you back. Thank you so much all for this, and I hope that we've managed to answer, and the whole session could help you in any way. I'd like to thank SeekMed, a telemedicine platform through video consultation with our award-winning doctors of national and from all over the world. And we promise back again on a webinar with new to answer your queries by our senior experts. And please like, follow healthcare updates and download the app for a video now. Thank you so much, sir. Thank you so much.